Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a program director, internal medicine residency program in one of the large university system, also a chief medical officer. Now, we've been doing a lot of lectures on the importance of in-service training exam. I've been in academic for so long. And what I notice, like people does not take in-service training exam very seriously, and the implications are too many. You don't want to do that. I think you may be listening to your friends and saying like, oh, it's not important, I just go there, I click on something and come back. No, it has huge implications for your future, so take it seriously. So we're going to go to the most important topic, what they ask in the in-service training exam. I don't think anybody else did it, maybe the first person to do it for you. So the topic today is urine anion gap. So let's start with the question. A 45-year-old woman with a history of chronic diarrhea, present with fatigue and muscle cramp, lab showing blood work, serum sodium 136, serum chloride 106, serum bicarbonate 16. Urine analysis, you look at urine sodium is 50, urine potassium is 25, urine chloride is 80 milliequivalent per liter, and arterial blood gas showing pH 7.32, PCO2 of 33. First, the question is asking, calculate the urine anion gap and determine whether the patient's metabolic acidosis due to renal tubular defect or extra renal losses, okay? You got the options, let's look at it. We said urine anion gap of 5, -5, renal tubular acidosis, -5, gastrointestinal bicarbonate loss, +5 renal tubular acidosis, +5 gastrointestinal bicarbonate loss. So what is the answer? It's -5 gastrointestinal bicarbonate loss, okay? First thing you need to know how to calculate it. You take the urine sodium plus urine potassium and minus the urine chloride, then you get the urine anion gap. So you got 50 plus 25 minus 80, that is 75 minus 80, you got -5, you get negative anion gap. So the only thing, couple of things can happen, negative anion gap is one, mainly, if somebody writing a question about negative anion gap, always number one cause is diarrhea. That's the most common cause, because a negative anion gap saying like there's nothing wrong with ammonia excretion, okay, in the urine. So when you take, when you having diarrhea, there's no renal tubular defects or anything kind of going on. So the ammonia secretion is normal, so they're going to have negative anion gap. Question number 2, which of the following condition most likely associated with a positive urine anion gap? So you got diarrhea-induced metabolic acidosis, type 1 renal tubular acidosis, D-lactic acidosis, hyperchloremic metabolic acidosis due to small bowel fistula. So the answer is type 1 distal renal tubular acidosis, okay? So when you have a positive anion gap, always think about renal tubular acidosis. Got it? Okay, now positive urine anion gap saying there's something wrong with your ammonia secretion, so there is renal tubular defect. So mainly type 1 and type 4 causes positive anion gap. Okay, that's important. Type 2 does not cause positive anion gap. Okay, so next question. A patient with metabolic acidosis following urine chemistry, urine sodium 20, urine potassium 15, urine chloride of 60. What does the urine anion gap suggest? What's the most likely diagnosis? Positive urine anion gap, distal renal tubular acidosis. Negative anion gap, proximal renal tubular acidosis. Positive urine anion gap, diarrhea-induced bicarbonate loss. Negative urine anion gap, hyperchloremic metabolic acidosis due to diarrhea. So what's our answer? First thing what we have to do, you calculate the urine anion gap, which is 20 plus 15 minus 60, 35 minus 60, you got a large negative urine anion gap. So when you talk about negative anion gap, you're saying the ammonia excretion is normal, so it has to be extrarenal causes like diarrhea, okay? Now question number 4, which of the following is the correct formula for calculating the urine anion gap? Urine sodium plus urine potassium minus urine chloride. Urine sodium minus urine potassium plus urine chloride. Urine chloride minus urine sodium plus urine potassium. Urine sodium plus urine chloride minus urine potassium. So the answer is you take the urine sodium and you add that to urine potassium and then you subtract the urine chloride, you will get the anion gap, okay? That's the formula. Let's look at the next question. A 45-year-old man comes for generalized fatigue, weakness, you have difficulty concentration, increased urinary frequency, labs the following: serum sodium 136, serum potassium 3.2, serum bicarbonate 17, serum chloride 110, arterial blood gases 7.33 pH, PaCO2 35, bicarbonate of 17, urine pH 6.5. Urine anion gap is the negative. So when you talk about urine anion gap negative, right? What is the negative urine anion gap? Those two things could happen, right? One is urine anion gap, always thinks diarrhea because there's nothing wrong with ammonia secretion there, okay? Also in the type 2 renal tubular acidosis, you can have negative anion gap, okay? So the answer is like, it could be, a proximal renal tubular acidosis. That is the type 2 answer in this. Okay, so remember, it's kind of confusing. Type 1 and type 4, you're going to have positive anion gap. Type 2, you're going to have a negative anion gap. Okay, and also you have to think about diarrhea. Usually acute diarrhea, not chronic diarrhea. Very, very important. I think the bottom line you have to remember, if you're taking IT exam, you need to know about urine anion gap. A lot of people don't know how to calculate it. Remember the formula: sodium plus potassium minus chloride, and if it is negative, what is it? You're talking diarrhea, and you're talking type 2 renal tubular acidosis, my friend. When it's become positive, what do you have? Type 1 renal tubular acidosis, you got type 4 renal tubular acidosis. Case closed. You have to know that. Good luck to you all. God bless. Please subscribe to the channel. Tell your friends about this. A lot of people don't know. You want to do well in your residency, you have to watch our channel. God bless.